pay their bills, you are enabling the disease, not the recovery. You have to stop. You have to stop doing that. Then there's the way I do interventions. I call it the horse whisperer approach. And what I prefer to do is to meet with the person one-on-one. Now, many times families will come to me and say, there is no way they're going to come talk to you. And say, au contraire, this is not as hard as you think. But here's how you do it. You do not talk to them by saying, don't you think it would be a good idea if you went and talked to Dr. Dunbar about your alcohol and drug problem? They'll say no. And they may, in great anger, back you off. And families are accustomed to that. So you don't do that. That approach doesn't work. It never has worked. You do what my wife does to me when she wants me to go see the doctor. She doesn't say, don't you think you ought to go see the doctor? I'll always say, no, this will go away by itself. It's not that bad. What she does instead is says, you have an appointment with Dr. Sloan at 2 o'clock. I go. Same with the families with me. I say, so it's an announcement. You announce you have an appointment to see the counselor on this day at this time. The only choices are, do you want to go by yourself or do you want to ride with me? That's the only choices. We're going. So it's an announcement. You don't discuss it. It's just a very short announcement. 99% of the times, that's all it takes. At most, sometimes we have to adjust the time to meet another day or a different time of the day. But that announcement approach works universally, and people are frequently totally amazed that it was that easy. But it is that easy. You just announce it. If necessary, arm twisting can be added to the announcement. So an example of an arm twisting is, you have an appointment this day at this time, and they say, I'm not going. You say, I'm leaving. You're leaving. I'm getting you locked up. I'm telling your parents. Whatever you need to do to raise the ante. Sometimes you can do that, and in talking with the families, we'll talk about contingency plans, but it's hardly ever necessary. Announcing is what you need. In any event, what I want to do is meet with the individual, just the two of us, the horse whisperer approach. And what I do is, in talking to the individual, I assume that they're very, very anxious at the prospect of coming to talk to me. So I want to reduce their anxiety to make them feel comfortable, and to explain to them who I am and what I do, and what I know briefly about them, that I've talked to members of your family or people that care about you, and they're concerned about your alcohol or drug use. And I think they have some reason for that. And our talking today is to determine, is there a problem, and if there is, what's a good idea, what to do, what do we do about that. And then I want to talk to them about their life in general, about their history, where they come from, their education, their interests and hobbies, and so on, as I'm just creating a way to establish some rapport and connection with them. And then I will move into talking about their alcohol or drug use, sort of from the history. Do you remember your first drink? What do you remember about that? Have you ever had the experience of drinking one night and go to sleep, and when you wake up the next day you can't remember a part of what had happened? Has that happened to you? How often does that happen? And then I will use these things as a way of teaching them stuff, which helps move this out of the realm of shame and guilt into it's just a matter of fact. If your blood alcohol level gets high enough, it will interfere with memory storage, with acetylcholine, that's a neurotransmitter involved in memory. And that's why that happens. I'll ask about withdrawal symptoms, about problems that their drinking has caused, legal issues, personal problems, work issues, employment problems, and so on. At the right moment, and this usually takes about 30 minutes roughly, I will ask them, do you think you have a problem with alcohol or a problem with drugs? And they always answer correctly. They say, yes, I do, or I believe I do, words to that effect. And that's the part of them that I want to talk to, is the part of them that knows there's a problem and has not been sure what the name of it was, or has not wanted to say that out loud. But that's the part of the individual that I'm wanting to connect to. Anyway, they answer correctly, and I say, you're right, and here's how I know that based on what you've told me about yourself and your alcohol and drug use. You're right, this is a problem. And then I will begin to talk about, what do you do about it? And there's a whole array of things that people that have alcohol and drug problems can do. Some just quit. Just like you've known people that are smokers and they just quit. No patches, no pills, no treatment, no nothing. They just quit. Some people can do that. Other people need help. So I'll talk about the whole array of things that you can do. Some just quit. Others go to AA or NA. It's free. It's everywhere. It's very effective for people that are able to be honest and open and want to stop. It can be a very effective thing to do. Going to meetings is part of that, but that's just one part of it. Having a sponsor, working the steps, are other parts of the program, but they will learn that as they go to meetings. If they want to go to meetings, then I want that to happen immediately. I'll either get up and take them to an AA meeting or a Narcotics Anonymous meeting, or arrange for that to happen within the next 24 hours. I know a lot of recovering people, and I will either take them to a meeting or arrange for them to meet with somebody near them that's like them, male, female, in terms of age, socioeconomic status, that kind of thing. And we'll match them with somebody that I know in recovery that attends meetings. And I just get out my little list. I'll call them up on the phone and say, Fred, I've got a man here that needs to go to a meeting he's never been before. He's near you and very similar history to yours. And I'd like for the two of you to arrange to go. Here's the phone, and let them talk and make arrangements as to where they will meet and to go to the meeting together. Going to the first meeting is a very scary thing for people to do. And going with somebody helps a lot to get that done. Incidentally, I like for the families to go to Al-Anon in the case of alcoholism, and to go to some open AA meetings and hear some stories. It gives them a lot of information, and it gives them some hope. Al-Anon is for the family and the friends of the alcoholics. Nar-Anon is for the family and the friends of drug addicts. Those programs are free, and they're all over the place. You find them in the phone book and on the internet to go to those meetings. But there's a great deal of support at those meetings. It's a great opportunity. Then in terms of treatment, there are outpatient programs, short-term, long-term. There's some they can go to work every day, and they go to groups in the evening, 1 or 2 or 3 nights a week, or every night. There are all sorts of outpatient programs. Then there